Hello, good evening. This is Dr. Ramya Sree Reddy, Consultant Fertility Specialist at Vinita Hospital. Today, we would like to discuss with you few aspects of diabetes and its effects on fertility. When we understand about diabetes, there are two types of them, type 1 and type 2 diabetes. The crux of the cause for both the diabetic types is different, wherein in the first type, there is a reduced or absent production of insulin hormone, and in the second type it is insulin resistance, wherein there is good amount of hormone of insulin produced that is not acting as amount as required. And now, after understanding the types of diabetes, it's important to understand why are we talking about it today. Because the burden of diabetes worldwide is increasing, and as we speak there are as many as 420 million diabetic population all around the world, and most of them are in middle income group countries as per WHO research. And we know that India is slowly turning out to be diabetes capital of the world. So we need to understand how it affects both men and women in the reproductive age. If we talk about men in the reproductive age, it has multiple effects at which it is acting upon. For example, there is a long-term neuropathy which leads to reduced erection in men, that leads to erectile dysfunction. Then apart from this, it has an effect on the DNA which is in the sperm. So with increased DNA breakage happening, the sperm DNA gets fragmented, and the same when passed on to the embryo causes abnormal genetic material in the embryo, which could lead to difficulty in conception, or it could also lead to frequent miscarriages. Apart from this, most diabetic men are also obese. So this increased weight also leads to reduced testosterone in the body, and thereby reduced testosterone in the scrotal area, leading to less production of semen and sperms. This leads to reduction in sperm volume, motility, and low testosterone also has a role in reducing the libido, and so the drive is lesser and lesser chances of conception thereby. Apart from these effects on men, let us see how it affects the women. In the female partner, there is both type 1 and type 2 acting differently. In type 1 diabetes, there is delay in the onset of first menstruation, that is the menarche is delayed, that leads to delayed conception and shorter reproductive age. Then in type 2 diabetes, there is increased insulin resistance. Now we understand increased insulin resistance is also a causative factor and has a good role in PCOS. So PCOS, obesity and diabetes, all three together have the same crux inside, which is insulin resistance, and all these will lead to altered menstrual cycles. So either the woman's periods are irregular, or she gets them too soon or too late. These are leading to anovulatory cycles, and when there is no ovulation, conception becomes complicated. So thereby it also causes increased ovarian aging because of the hormonal imbalance, and this ovarian aging faster also leads to decreased reproductive lifespan in a woman. Now, after talking about various effects, we would like to understand what can be done to tackle these problems. A multidisciplinary approach is what is very much important. So when a woman or a man is diagnosed to be a diabetic, it is important that they see a dietitian, a good team which has both a dietitian, an endocrinologist, a gynecologist and an andrologist as per the requirement. A gynecologist will be the person who will help you out if you have any menstrual irregularities and help you get your cycle on track. Once that is taken care, if the man is also a diabetic, an andrologist would be a person who will be able to help you out with this. With good sugar control and ensuring that you maintain a good diet with your sugars low and high protein, and good amount of moderate exercises like some brisk walking, yoga, these kind of things, keeping your general health in check, you will be able to conceive faster. With the help of small modifications, if you're not able to conceive, this would be a good time to see a fertility specialist who will be able to help you achieve your dream faster. Thank you.